they also are relatively religious compared to the average pediatrician, let's say.
Yeah, for sure.
And they sort of love me, even though I'm an agnostic Jew.
Yeah, I really want to touch on that actually, because from the video we watched with him, who's of a high ranking in the American College of Pediatricians, he quoted your studies in the 90s, and she followed along with it. And they kind of seemed, if I can read here, they took away from it that this was kind of a that your study helps discourage the idea of affirmation therapy. Could you speak to that? And do you think that's the correct takeaway?
Well, I mean, one of the dilemmas in this area is that it's not always easy to differentiate politics from science.
Mm-hmm.
So, for example, um, if we talk about children, adolescents, and adults
Yeah.
who experience gender dysphoria, one could argue that any treatment, whether it's biomedical and social, like let's say with an adult socially transitioning, hormone therapy,
Mm-hmm.
gender affirming surgery, what is the goal of it? It's to reduce gender dysphoria.
Yeah.
Um, and one could say that any treatment in theory is designed to reduce gender dysphoria. So then the clinical question is, what's the best way to help somebody reduce their gender dysphoria? Because in theory, the definition of dysphoria means you're unhappy about something, and presumably it doesn't feel good to have dysphoria.
Yeah.
And my own approach, because I'm a child psychologist,
Mm-hmm.
has always been to take a developmental approach in terms of reducing gender dysphoria. So what I might recommend for an adult, although I don't particularly work with adults, primarily work with children and adolescents, but what one might recommend for an adult is going to be different from what I might recommend for a 13-year-old, and that might be different from what I recommend for a 3-year-old.
Mm-hmm.
And so I don't think one size fits all, and it gets even more complicated when you take into account where somebody is at developmentally. So as an example, if you look at follow-up studies of children, and so what do I mean by children? I mean a kid anywhere, say, between the age of 3 and 12 who comes in and gets an assessment and maybe has treatment, and then you follow up these kids when they're adolescents or young adults,
Mm-hmm.
what percentage of them still have gender dysphoria? And the follow-up studies to date have shown that a large percentage of little kids with gender dysphoria don't continue to have gender dysphoria when they're older. So, for example, in our 2 Toronto studies, the percentage who continued to have gender dysphoria was only 12%. So it's a small percentage. But if you look at adolescents who come in with gender dysphoria and you follow them up later,
Mm-hmm.
probably a large percentage of them continue to have gender dysphoria unless they socially transition
Yeah.
and get biomedical treatment.
Mm-hmm.
And so one of the criticisms that I have to do with how some of the follow-up studies of children have been interpreted, is that I don't think you can use the data from children and apply it to kids who come in the front door for the first time in adolescence. And certainly I wouldn't apply it to adults who come in the front door with gender dysphoria. So sometimes I think people like Van Meter may use the data on children to make generalizations, say, to adolescents, which I don't think is warranted.
Yeah.
And I think that's reflected, for example, in my own therapeutic approach, where for some adolescents, after I do an assessment, I will recommend biomedical treatment like hormonal suppression. In fact,
Yeah.
our clinic was the first one in North America going back to 1999, where we began to recommend hormonal suppression. You two probably weren't even born in 1999.
I was 2 years before.
I was just born that year.
Yeah. So, I mean, we were certainly considering that as a approach to reduce gender dysphoria a long time ago.
Yeah.
So, yeah, one always has to carefully evaluate how people, I mean, as a scientist, you have no control over how people are going to
Use your data.
interpret your data. And
Yeah.
it's not easy. You know, one could spend one's entire life, counteracting things that are said on Twitter or on YouTube,
Yeah.
as opposed to like discussing it in scientific journals, right? There's only so much time one can
Yeah.
spend on these things.
I think a dangerous thing that Laura seems to be doing, and Dr. Quentin as well, that they seem to be conflating counseling and conversion therapy as being one and the same. And they appear to also be claiming that affirmation therapy and counseling are mutually exclusive as well. So through the video of them discussing your study,
Yeah.
it seems that they take your study as more of a counseling, right? They, like I said, they're conflating the words bent, and as not opposed, it's not like an affirmation type thing. But from reading your studies and what you did, your studies obviously involve counseling, which is a form of affirmation, if I'm not mistaken, as well, right? There's a long process to go through when you're taking someone into account with gender dysphoria, correct?
Yeah. Well, these various terms like affirmation, conversion, I mean, they're also, very politically loaded terms,
Yes,
right?
yes.
So, they're going back, originally in California, a number of years ago when they passed legislation saying that it's basically against the law to use conversion therapy with regard to sexual orientation.
Yep.
I can't remember if it was only applied to minors or if it also included adults. But politically, what's happened is gender identity has now been added on to all of these bills that at least originally were designed to ban conversion therapy with regard to sexual orientation or homosexuality.
Mm-hmm.
The reason it's a political issue is that no mainstream clinician, social worker, psychologist, psychiatrist, practices conversion therapy with regard to sexual orientation.
Yeah.
Nobody in the mainstream. Yes, I'm sure there are the pastoral counselors and the other religious folks who, quote, practice it. but mainstream mental health people, nobody does it.
Yeah.
So it's really become more of a political issue with regard to children and adolescents with gender dysphoria.
Mm-hmm.
That's really what's going on behind the scenes. In Ontario, they passed some legislation a few years ago. I think it's Bill 77, where it basically said that you can't try to change a minor's sexual orientation or gender identity. Although if a minor was capable of giving informed consent,
Yeah.
you could do anything you want. So suppose a 15-year-old girl came to a clinician and said, "Can you make me gay? I don't want to be straight."
Yeah.
If you think the kid's capable of giving informed consent, in theory, you could say, "Sure, I'll try to help you be gay." Although probably the average clinician would say, "I don't know how to do that. Maybe you can do it on your own, but I have no idea what to do."
Yeah.
So really, you know, if you're talking about minors who can't give informed consent, you're really talking about little kids,
Yes.
like a 3-year-old. So let's say a parent brings in a 4-year-old who has gender dysphoria. The legislation would imply that you can't try to help that kid's gender dysphoria go away. However, if you read all of these bills carefully, they always have this legislation does not apply for the following things, and it'll include things like hormones or surgery, but it also includes identity exploration. And I can send you a PowerPoint presentation I did a few years ago that
Sure, that'd be great.
actually
Yeah, terrific.
shows you the exact wording. So in theory, you could say to the parents of a little kid, well, we're not going to try to change your child's gender identity, but we're going to explore why your child is feeling the way they are and see what happens. Now, where it gets a little hazy is, what does identity exploration mean?
Yeah, it's pretty
So
loaded,
if you're doing therapy, what would be an example of identity exploration? So for example, suppose a little boy who says he wants to be a girl tells you that he's afraid of other boys, like he thinks they're too rough. And so that's why he likes to play with girls, because they're gentle and nice. Kid doesn't know any mean girls, right?
Mm-hmm.
Well, you could say to the parents, well, maybe you could help Johnny find a few boys who are not too rough and see if Johnny feels more comfortable playing with the gentler boys. Now, does that count as identity exploration? Or would somebody say, oh, you're just trying to convert the kid? And the problem is, parents who want to explore their kid's gender identity, they're not going to complain that the therapist is suggesting to do this or that. And parents who don't want to explore anything aren't going to go to a clinician who is open to exploring. So there's never been, to my knowledge, in Ontario, anybody complaining that a clinician was violating the bill. So it's very tricky, but, let's think about, adolescence. Sometimes I'll see a 14-year-old kid who comes in and says, I'm confused about who I am.
Yeah.
I need to talk to somebody. Well, I don't think the legislation prohibits you from saying, okay, let's talk about how you feel about yourself.
Yeah.
Where it's difficult in this area is when people are taking a political stand about something and trying to use things to fit into their political agenda.
Yeah.
And that's where it gets messy. And it can get messy, you know, on all sides of the spectrum.
So it seems to me that your only like little philosophical strife or more questionability is with people that are under the age of 18, because things can be much more up in the air, whereas people who are older probably have a better sense of who they are, and you can probably take more actions in regards to that. Am I correct? Like, you were just a little more tepid on people under 18 with wanting to transition or whatever?
I think that among adolescents, you know, there's a lot of variability there.
Mm-hmm.
I mean, there's been an explosion of adolescents coming to hospitals or clinicians who are experiencing gender dysphoria. And clinically, they're much more heterogeneous than they used to be. Like, they're coming to it from a variety of places.
Yeah.
So I don't think that, you know, a one-size-fits-all perspective is at play. I think, for sure, I think when adults come to see a clinician, probably most are pretty sure about
Yeah.
where they're at, but I think also some adults are still wrestling with what they want to do. And the legislation really doesn't apply to adults, you know, or even minors who are considered giving informed consent. So, you know, if a 25-year-old female comes in to see a clinician and says, I'm confused about myself, I don't think that your first line of treatment is going to recommend that this person have a bilateral mastectomy. I mean, if somebody's...
Yes, yes. And I was just going to say, this seems to be, from what I can understand from Laura's videos, is what they think when it says you can't do conversion therapy and you can only do affirmation. I think their worldview thinks that, like, once a kid goes into a place and says, I feel this way, the doctors go, awesome, grab them and then just do whatever. Could you explain how long the process is of actually, when especially a younger person comes in and says, I feel this way, what procedures you go through and how long it takes?
I think it really depends a lot on who you see and where you're seen. So
Mm-hmm.
I'll use as one example the Dutch gender clinic in Amsterdam, because I do some research with them and a lot of them are my friends.
Yeah.
Currently, they have an incredibly long waiting list. Like, it might be 12 to 18 months before an adolescent is even seen.
Wow.
Yeah, it sucks. And then, just because of their own idiosyncratic approach, they might take 6 to 9 months to finish an assessment. So let's pretend these numbers are, you know, suppose it takes a year to be seen and 6 months to finish an assessment.
Yeah.
That's a year and a half already
Yeah.
before they might recommend, say, hormonal suppression. So that's probably on one end of the spectrum. Then, you know, for sure, there are some adolescents who could go into a walk-in clinic or see a trans-positive GP,
Mm-hmm.
and they'll get a prescription for testosterone after half an hour.
Yeah.
These timelines are not well documented in any systematic way in the literature, but I'm basing this on, you know, what patients tell me, what I've heard. So there's a lot of variability. And in terms of getting, specific numbers, you really have to, ask specific clinics or clinicians, how long of a time, does it take before you make a decision? Now, currently what's really been trending on YouTube and Twitter are mainly these birth assigned females who are detransitioning.
Yes.
I don't know if you've looked at any of their YouTube.
I've heard of one person, not YouTube, but someone in England who transitioned, I think surgically as well, and then now they want to detransition, and they're kind of being pedestaled as an example of why we shouldn't go through with any of the
And there's a
transition.
lot of them. Like on my Twitter feed, like a new one comes across every couple of days. And,
Yeah.
And, some of them will say that, in retrospect, they thought clinicians were moving too fast. Others will say, oh, I got seen, by a bunch of people over 6 or 9 months. And, I really was sure that this was what I wanted.
Mm-hmm.
How couldn't they tell that I had all of these other issues?
Yeah.
So it's pretty confusing.
Yeah, I mean, if I may, to me, like philosophically, what this kind of sounds like to me is like we are loading these people so much with like whatever they come out with has to be how we dictate policy. I mean, like because you could say the same thing about I guess someone having a child. Most women that have a child like their child, but some of them have a kid and then they hate them. So should we take those people that hate the kid and say no women should have children anymore? It's kind of what it sounds like to me. A lot of these are personal choices for people, and whether they come away with a good perspective over a bad one, it's up to that individual the takeaway. In my opinion, I think.
I think that this, we have no idea how many detransitioners, regretters are, but as clinicians, obviously we want to know what the hell is going on, because
Yeah.
I don't think any reasonable physician or nurse is going to recommend, let's say, a mastectomy for a birth assigned female, or, castration and penectomy for a birth assigned male, unless one is pretty confident they're not going to regret it. And
Yeah.
in the old days, there was pretty careful, if not overly strict, screening for these things, which people didn't like. So, like, back in the day, say in the 70s, say you were in Sweden,
Mm-hmm.
and you were born male, if you were married, you had to get a divorce. If you were male, you would have to agree to be sterilized before
Oh wow.
they would do anything.
Okay.
So it was pretty, pretty heavy.
Yeah, it is.
Now, there are still protocols that many people follow, but some people, including some clinicians and some trans activists, are of the view that mental health shouldn't be involved in any of this. And they favor what's called the informed consent model. So they would take the view, I should be able to go to an endocrinologist and say, I want hormones.
Mm-hmm.
Or they should be able to go to a surgeon and say, I want surgery, and shouldn't have to be approved by anybody. So that's a big tension in the field.
Mm-hmm.
And I think that maybe the average surgeon might be a little hesitant to go with the informed consent model, but maybe not all of them. I mean, in the States, their main motivation would be, I don't want to get sued.
100%, yeah.
So, they want to, I think, dot their I's and cross their T's.
Mm-hmm.
But it's very political, right?
Yeah. Would surgery and hormone blockers though be on the same level? To me, it just seems that surgery is a much more that's a much more daring thing to go through. As hormone blockers and testosterone, I think they're a lot more like
So
there's not as many
basically,
repercussions.
view it as a series of terraced steps.
Yeah.
So at the lower rung, things are completely reversible. So
Yeah,
let's say
exactly.
you socially transition. If you change your mind, you just detransition.
Yeah.
Say you legally change your name. Well, you can change your name in Ontario twice in 1 year. So just change your name back.
Mm-hmm.
Hormone blockers, the general argument is that they're reversible. So if you pause
Yeah.
puberty or delay puberty, if you stop the treatment, things just start up again.
Yeah. Yeah.
And when you get into things like estrogen for birth assigned males, testosterone for birth assigned females, people would say it's partially reversible. So if you look at some of the YouTube videos of birth assigned females who have detransitioned, most of them have pretty deep voices.
Yeah.
That's probably the most notable parameter that isn't completely reversible.
Mm-hmm.
And then, of course, surgery is completely irreversible.
Yeah.
And so, what I talk about with adolescents is, we're going to go one step at a time.
Like I was saying, it appears to me that you are totally okay with doing the more subtle things like hormone blockers or test with people, let's say under the age of 18, and once over, you're a little more accepting to open up to maybe surgery or whatnot. Like, are you like hard no on anyone under 18 getting surgery? Because like I'm really confused on that too, philosophically, if that should be a thing that should even happen. I really don't know.
The standards of care of the World Professional Association for Transgender Health
Yep.
has a lower bound age of 18 for genital surgery,
Okay.
but they don't have a lower bound age for bilateral mastectomy,
Mm-hmm.
which is interesting in its own right. Like,
Yeah.
what does it mean that for natal females it's looser?
Yeah.
But I um, I've probably had a few patients who have received mastectomy around the age of 18, but
Yeah.
there are some kids who are getting mastectomies at like the age of 12, 13, 14. I probably just don't see those kids. They go somewhere else.
Yeah.
And I think that, we're in an era where, families can go doctor shopping, right? So there are some surgeons who will perform mastectomies on 15-year-olds without asking for any mental health letter. Just pay me cash.
Yeah. And that's just to kind of put the nail in the coffin with this, with Laura's video and Dr. Quinton. Again, they really seem to be using you to almost disavow trans people as a whole. And do you think that's like fair at all to what you do? Because from what I can read from your studies, it doesn't seem like that's the case at all. It seems like you can actually, we meant to ask this too. It seems like there was some sort of debacle that happened with you with the University of Toronto where you somewhat got defamed, and they've latched onto that defamed version of you to drive their narrative, it appears. Do you think that's a fair assessment?
Well, I was in a gender identity clinic at a hospital called the Center for Addiction and Mental Health.
Okay.
So not the University of Toronto.
Okay.
And I got executed in 2015.
Mm-hmm.
And journalist Jesse Singal wrote a couple of really important essays about it in 2016.
Yeah.
In New York Magazine. And if you look Jesse up, you can read it about it.
Okay.
I wound up suing the hospital, and after 2.5 years, settled a lawsuit, and I received about $550,000. They paid my legal fees of $175,000, and they publicly apologized.
Yeah.
So if I ever meet you guys, I can take you out for a beer. I have a little spare change.
Nice. Yeah. No, I read that. I read the 500 grand part.
Yeah.
I remember that part.
Yeah.
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 So yeah, do you think that is what happened though? Is what from what I read about it, it was that they almost slandered you that you were a conversion therapist. You were doing things that were harmful.
I
Is what
think that's what, the activists were accusing me of.
Yeah.
And in the era, we're in an era where I personally feel we're sort of in an era, you guys may not like this, but feel we're in an era of left-wing McCarthyism,
Mm-hmm.
as opposed to the 50s where it was right-wing McCarthyism, if you say something, if you're accused of believing something, things can really explode quickly.
I'm very left. There's a certain subset group that I know what you're speaking to, like that they go off the rails. It's kind of like that white liberal type of identity politics person. It's really hard to try to differentiate you from them. But it definitely is an issue. And with what happened with you too, it appears like that when they defamed you, it gave ammo to another group like Laura to grab that defamed version of you and use that to drive their narrative forth too. So everything was just meshed.
That's politics, right?
Yeah.
Yeah.
Last year, I think it was in May, so May 2019, Megan Murphy invited me to give a talk out in Vancouver.
Yeah.
You probably know her, right?
I've heard of her, yes.
Yeah.
I have.
And it was really interesting because, the talk was at some cultural center on the outskirts of downtown Vancouver.
Mm-hmm.
And so on the inside, there were all of these, there were some religious folks, a lot of lesbian feminists,
Mm-hmm.
a lot of feminists. And then out on the lawn, there were all of these protesters against Megan Murphy, etc.
Yeah.
And what was kind of interesting was based on people's clothing style and hairstyle and number of tattoos, I couldn't tell the difference between who was inside and who was on the outside.
Yeah.
So it's kind of confusing.
Yeah, it is really. I wish everyone just wore armbands that told you everything about it.
Right. Yeah, there should be color-coded wristbands or something.
Yeah.
But yeah, it's it's we're in an era now where gender politics are right at the top, along with the politics of race and ethnicity and
Mm-hmm.
the Me Too movement. It's pretty intense.
Yeah, but to put a cap on this,
Yeah.
with Laura trying to show you, or it wasn't Laura, but she was opened up to Dr. Quinton, who was using you as a catalyst to see pretty much that trans people aren't valid. I guess.
Well, here's like sometimes an adolescent says to me,
Mhm.
I need to have a diagnosis of gender dysphoria to prove that I'm really trans. And what I say is, trans is an identity.
Yeah.
Gender dysphoria is a diagnosis.
Yeah.
And who you are is your own subjective construction. And it's up to you to figure out who you are as a person.
Yeah,
So,
for sure. So you think trans people are valid? Like that, if someone says they are, you generally will believe them, or at least not even that. You accept that trans people are a real thing. I'm assuming.
to me, as I said, I try to separate, the diagnosis from the person.
Yeah.
You're a person.
Mhm.
Your subjective experience right now is this. And if the way you need to live your life requires X, Y, and Z,
Mhm.
I'm going to help you achieve that.
For sure.
Because I also say, look, the most important thing is you have a good quality of life, whether you're trans or not trans or somewhere in between.
Yeah.
Um,
So your measure is just based on overall happiness. If it makes the person happy and does less harm to
yeah.
them and
And
others, then
I mean, one of the, I think, misnomers about diagnosis over the years, transgender has never been a diagnosis.
Mm-hmm.
So, yeah,
Okay.
it's intensely political.
I know. I mean, like I'm fresh in this. I've only been reading up about gender identity, politics stuff in the last year. Really, I've come around with a lot of it too. But yeah, it is quite a can of worms, really. Well, Dr. Zucker, thank you so much for this.
Yeah, this is
It's
great.
been a pleasure, man. I really appreciate it. And yeah, if you're ever in Vancouver or in BC in general, don't be afraid to
Yeah,
email
I'll
us.
check in with you guys. I have
Yeah,
a few good friends in BC,
awesome. Yeah, and if I'm ever in
in
Toronto, I might.
Vancouver.
Yeah, yeah. So
Yeah,
yeah,
if you come to Toronto, pop me an email.
for sure.
Hopefully, it won't be dangerous to actually
Yeah.
meet
Yeah,
people.
while we're living in our utopia here.
Yeah.
Yeah.
We'll come on a safer day.
Yeah, for sure.
Okay.
All right, awesome. Well, Dr. Zucker, thank you so much.
Take it easy.
Appreciate it. Have a
Thank
good one,
you.
man.
You too.
Bye.
See ya.